So my name is Dr. Beth Moore. I'm a colorectal surgeon in Beverly Hills, and a few months ago I was diagnosed with breast cancer, and that's what brought me to Dr. Cassileth. I've known Dr. Cassileth for years and years and years. We're co-surgeons together. My first mammogram at the age of 40 was abnormal. It showed what's called microcalcifications, and the biopsy of that showed atypical ductal hyperplasia. So it puts me at an increased risk of having breast cancer. So I've been monitored very closely for several years now, not only with mammograms, but also with periodic MRIs and then periodic biopsies. So in this recent follow-up, my mammogram was completely normal, but on the MRI, they found 2 small lesions that were biopsied, and one of them came back as cancer. So that's easy. I chose Dr. Cassileth and Dr. Richardson because I've known them for years. We work in the operating room together. I first met Dr. Cassileth actually in Guatemala. We went down to Helps International and we operated for 10 days down there on the folks, and that's where we first met and had an amazing time. And we've been close friends ever since. We do a lot of major cancer operations that she helps me with the plastic surgical aspect of it. They're both excellent surgeons, so it wasn't hard. It was an easy, quick, these are my team, these are the people that I know are going to take care of me. Well, I had my surgery in the surgery center that I own, and everybody in there I know. And I'm sort of like a little bit of a badass in the operating room. People are a little bit afraid of me in the operating room because I'm an old school surgeon, and I had to be in a vulnerable position. But the team that was taking care of me were outstanding because I've known them for years, and their work ethics are absolutely amazing. It was very scary, and it still is. It was very intimate in a weird way that I had to be with my team, but I knew that I was in the best of hands. Dr. Cassileth has an amazing program here for breast cancer and breast cancer reconstruction. She puts a whole package together so that you have the lowest complication rate and the best cosmetic result. So she works on peptides, she works on hyperbaric oxygen, she works on nutrition, all of those things. And then she has an amazing team, particularly Cara Lee, who keeps an eye on you. She's like a giant mama bear that will come after you and make sure that you're doing all the right things. And her follow-up is really, really amazing. And what's really cool about it is cosmetically, once it's all healed and said and done, I actually have like 18-year-old breasts right now because you can hardly see anything. It's really amazing. I actually show people my boobs all the time, and I never thought that I would, but it's like, hey, you want to see this? And they're like, oh my God, that's pretty cool. So, and I always say, well, they're not mine anymore, but they're pretty cool looking. So it's an amazing program. Well, it was a hard recovery. The first month was pretty hard. I'm a sole provider, I'm a mom. I went back to work early, probably way too early than I should have, but that's all behind me. I still have some recovery left, just some little things that will take a little while to go away, but I'm really, really happy with the outcome. But you know, you still live in fear. You have breast cancer. I'm stage 1. I should be cured of this, but it still reminds you every day that you have it. I think the great thing about us is that we're friends with Dr. Cassileth and Dr. Richardson, and I have their permission to say this. So, you know, they have looked after me for my, breast cancer screening, and I actually look after them for their colorectal cancer screening. So, they've seen my boobs and I've seen their butts. So, we all sign a consent form, but we actually take really good care of each other.